Hello, this is Dr. Trent Stevens again. I am continuing my lecture series on gross anatomy. This is lecture number 2, which is anatomical terms and regions. Oops, went too far. So in terms of anatomical terminology, it's important for us to understand the history of terminology itself. As I mentioned in lecture 1, it's important for us to understand the original Greek or Latin words. As I teach anatomy, I never introduce a new anatomical term without defining it. I define its origin as well as the meaning, the original meaning of the word. So if we look at anatomical terminology, we have an interesting recent history, a little over 100 years ago, 125 years ago, actually. So at that time, by the end of the 19th century, it was discovered that because of different languages and different people contributing, there were somewhere around 10 names for every structure in the human body. Somebody needed to do something about it, and somebody turned out to be the German Anatomical Society. In 1895, the German Anatomical Society meeting in Basel decided that they were going to deal with this, to try to pare this down so that there was only one accepted term for each anatomical structure. And that resulted in a publication that was privately circulated called the Basel Nomina Anatomica, or BNA. That was published in 1916. There are copies of it that can be found around. And if you look in the medical dictionary, you will occasionally find a word in the dictionary that has BNA listed after it. And that means that this comes from that term originated with this attempt to get rid of the extra terminology. And it's refers to this 1916 publication. Then in 1950, at the 5th International Congress of Anatomists, which was held in Oxford, there was an international nomenclature committee established. And their assignment was to again come up with a new set of terms, kind of what the German Anatomical Society had worked on some 50 years earlier. And this international committee in 1955 published what's called at the 6th International Congress in Paris, published what is called the first edition of Nomina Anatomica. And that's abbreviated NA. And occasionally you'll see in the medical dictionary the word NA instead of BNA, and NA means that it derives from Nomina Anatomica. And that paper was only privately circulated in 1955. Then in 1961, the 2nd edition of Nomina Anatomica was published. And that was a list of descriptive terms. And the big thing that was accomplished in Nomina Anatomica, which was the first one that was actually available to a wider audience, was that eponyms were eliminated. Anatomical names named after a person were eliminated in this edition of Nomina Anatomica. And that was one of the goals of this International Nomenclature Committee. A lot of the terms that we see in anatomy now are the results of the work of this committee. And so a lot of the more modern terminology dates from basically 1961. And so there's a lot of old terms, especially if people use eponyms. When I was taking anatomy back in the 1970s, there were still a lot of people using a lot of eponyms. That's sort of been weaned out more as time has progressed. But occasionally you will still hear someone using, say, the sphincter of Oddi, which is in the duodenum, or we still use eponyms where they make, to most of us who are teaching, make more sense than the actual non-eponym term. For example, we still use the circle of Willis to describe the arterial circle at the base of the brain, which is, the official name of it is the cerebral arterial circle. It seems like there's another name in there that I'm forgetting, but it's a kind of a long and cumbersome name, and so a lot of people still refer to it as the circle of Willis. Then in 1977, the 4th edition of Nomina Anatomica included the Nomina Histologica and Nomina Embryologica, but people didn't like that. Most anatomists, at least, certainly many anatomists, are not histologists, and people teaching histology weren't necessarily anatomists. Embryology was even worse, because in 1977, it was deemed that embryology was kind of an old term, and people wanted to consider themselves as developmental biologists. Many developmental biologists come from a molecular basis rather than an anatomical foundation, and therefore they didn't want a bunch of anatomists telling them what they could and couldn't name things in embryos. And so both Nomina Histologica and Nomina Anatomica, or Nomina Embryologica, didn't last very long. In 1989, the 6th edition was published, and that was the last edition of Nomina Anatomica. Because in 1998, 24 years ago now, there was a change from Nomina Anatomica to what's now called Terminologica Anatomica. And you can see Nomina Anatomica, the first Nomina Anatomica is to the left. The middle one, I believe, is the 5th edition, which is the one I have in my library. And then Nomina Terminologica was published in 1998. And the whole point of Nomina Terminologica was to put things in English terms. For example, if you look at the deltoid muscle, the previous Nomina Anatomica up to 1989, the book was simply a list of purely Latin terms. So the deltoid muscle in the shoulder would be musculus deltoideus, and that was it. There was no other explanation. In Terminologica Anatomica, the name is now listed as deltoid muscle, and then musculus deltoideus, at the Latin term, is a second name for it. So that's sort of where we are today. Terminologica Anatomica is available not only on a CD, but is available online as well. So with that introduction, let's take a look at anatomical terminology. So if we look at a person standing facing us, as we see the person on the left, she is in what's referred to as anatomical position, and that is feet together, toes facing forward. The hands are to the side with the palms facing forward so that the thumbs are on the outside. This is the so-called anatomical position. If we start, and then we can go to the person on the right, which is looking at the person from the side, so we can add a few more terms. So let's start with superior and inferior. Superior simply means that which is above. Inferior means that which is below. We also have synonyms for those. Cephalic means toward the head. Cephal means head. and caudal means tail. So we have those terms also. Now, the problem with caudal is that in the human, caudal is going to end at the base of the spine. It's not going to continue on down into the lower limbs. It only refers to really the trunk, because if you think about it, cephalic meaning toward the head doesn't make a lot of sense when you're in the head. And so even though the line here, the arrow shows it going all the way to the top of the head, it really should end at the top of the neck. And so it really, those terms really only refer to more to the trunk region. When we get into the head, there are other terms that we can use that are actually more. We do use superior and inferior, but we can use other terms as well. Now, going to the limbs, because superior and inferior really only talk about the trunk, we can look at the limbs, and we can look at those in both figures, both the one on the left and the one on the right. The one on the right shows the lower limb only being labeled. The one on the left shows both lower and upper limb. So we have the word proximal, which literally means to stand by, to be nearby, to stand close by, and distal, which means to stand far off. So proximal means closer to the attachment point, and in terms of the upper limb, it's the shoulder. For the lower limb, proximal would be the hip, and distal would be toward the foot. We can also talk about proximal and distal when it comes to other organs. We didn't have to describe the whole body. So, for example, if we look at the small intestine, the proximal part of the small intestine is the part toward the stomach, whereas the distal part of the small intestine is the part farthest away from the stomach, toward the large intestine. Now, if we go to the figure on the right, there's only two other terms that are there. One is anterior, which means these are actually movement terms. Anterior means that which goes before. When you're walking, your belly, your chest is preceding the part that's posterior, which is literally means that which follows. So these are movement terms, and in the human, those terms are synonymous with ventral. Venter means belly, and so the ventral surface is the belly surface, and dorsal, which literally means back, is equivalent to posterior in human anatomy. Now, if we go back to the figure on the left, we can look at the midline. You can see a dashed line down the midline. Going toward the midline is medial, and going away from the midline is called lateral. So medial means toward the center, lateral means away from the center. We also use the terms right and left anatomically. Now, if we look at these concepts of cephalic and caudal and dorsal and ventral, if we look at a human, let's go over to the right side list. As we saw in the previous slide, cephalic is equivalent to superior for the most part. Caudal is equivalent to inferior. Dorsal is posterior, and ventral is anterior. Now, if we look at a quadruped, like a dog that is standing on all four legs, the whole orientation ends up being 90 degrees off. So cephalic in a dog is anterior, because anterior means that which goes first. So in the case of a dog or a cat, it's the nose, it's the head that's leading. Whereas in a human, it's the chest and the abdomen that are leading. Caudal is the tail, and it's obvious that in a dog or cat, the tail is the last thing going through the door, whereas in a human, that's inferior. Now, if we go to dorsal in a human, that's posterior, but in a dog or cat, that is superior. So dorsal, that is the back, is facing up in a quadruped, and ventral, which is the belly, is facing down or inferior. Now we can look at a person again in an anatomical position, and we can look at a whole bunch of other structures that we can name. It's important that you understand this terminology because anatomy being a very heavily terminological science, we make reference to these things all the time. And also the previous slide, 2 slides ago, when we were looking at things like dorsal and ventral, medial and lateral, we talk about those all the time in anatomy. So it's important to understand that as these are basic concepts in anatomy. So let's start with the head on the list of the upper left, which means, so the word cephalic refers to the head, cervical, and you can see a bracket in cephalic. Cervical refers to the neck. Cervical literally means neck. So if we look at the head, we have the frontal part, which is the forehead, the orbital region, which is the part around the eye. Nasal means nose, and oral means mouth. A lot of those terms we're familiar with because of various medical professions. For example, you go to an oral surgeon who is a surgeon, a dentist who does surgery on the mouth. If we look at the other side, at the right side of this person, we can see that otic means ear. That's what it literally means. Buccal means the cheek, and mental means the chin. Those are so for example, a lot of we use both nouns and adjectives in describing a lot of these things. So if we look at both of these lists, they're all adjectives. So we could use the noun region after each of these: the frontal region, the orbital region, etc. There are really, and for many of these are, while there would be nouns, they're not used anatomically. One exception to that is, for example, mental, which means chin. We do use the word mentum, which is the noun related to that adjective. So it's kind of interesting. In anatomy, we use both nouns and adjectives where we find them convenient. It's just mostly a matter of the rules of what sounds the best. Now, if we go down on the right side, outside of the big brackets, we see the word clavicular, which refers to the collarbone, and the word for collarbone is clavicle. That's what it actually means. It means the collarbone. Now let's go back over to the left side. The big bracket is the trunk, and we have inside of that another bracket which is referred to as thoracic, or that's the adjective, or thorax being the noun. We don't have a common name for thorax. It's the region of the chest, but it's not. So you can see that the word pectoral actually means chest, whereas the word sternum refers to the breastbone, and mammary refers to the breast itself. So, and again, that's an adjective. Mammary, mammary would be the noun that refers to the breast area. We go down to the next 5 terms that are in the bracket for the trunk. We have abdominal, which is the adjective, and abdomen, which is the noun. And we typically don't have a more generic common name for that. The word belly is the term that's often used. I've heard people that are not in the medical field describe the whole thing as the stomach. which is quite a misnomer, but it is oftentimes used. The umbilical region, or the belly button, if you will, is referred to as the umbilicus or the navel. Navus would be the noun for that. And then as we go on down to the next three, we have pelvic, which the word pelvic means a basin. A pelvis is a basin. And so that's what the term actually means. Inguinal refers to the groin, and it's a specific term that refers to that part of the body, as does pubic for the genital region. Now, if we go to the right side of the figure, we have big brackets for the upper limb and the lower limb. So let's start with the upper limb. We start with the word axillary, which means the armpit. We use the word brachium, or brachium being the noun, brachial being an adjective, which means what's called the quote arm. That is the region between the shoulder and the elbow. A lot of people talk about the arm as being the entire upper limb, or the Latin for that is membra superioris, the superior or upper member. But the word arm anatomically only refers to the area between the shoulder and the elbow. The elbow itself, the front of the elbow, the anterior part of the elbow, is called the antecubital region. And then the forearm is called the antebrachial region, or antebrachium being the noun. Now, what ante means is opposed to. And so when we flex the elbow, the forearm becomes opposed to the brachium, so that's why it's called antebrachium. We can continue down into the wrist, which is called the carpum. The word carpal being the adjective refers to anything in the wrist, and so there are 8 bones called carpal bones. In the palm, in the hand, where we refer to the anterior part as the palmar region. The bones in that region are referred to as metacarpals, meta meaning beyond. So these are the bones beyond or distal to the carpal bones. And the word, and the fingers are referred to as digits. The bones of the fingers are referred to as phalanges. And a phalanx is a Greek military formation that looks kind of like my hand, with soldiers with shields, and my fingers would represent spears sticking out between the shields in a V shape. So it's that V-shaped military organization that's referred to as a phalanx, and it's not your individual fingers that are referred to as phalanges, but the bones within the fingers. The fingers themselves are referred to as digits, digits being numbers, and so it refers to you basically counting with your fingers. So if we look at the lower limb, or the membra inferioris in Latin, we see the word coxal, which means the hip. We see the word femora, which means the thigh. The word femur, which we apply to the bone of the thigh, actually means the whole thigh. It doesn't refer to the bone, although we have used that term to name the bone. The word patella means the kneecap. The kind of like the arm being the proximal part of the upper limb. The leg is not the full lower limb. It is the area between the knee and the ankle anatomically. And that area is referred to as the crural area, or the crus, being the prop that holds the crutch, the prop that holds us up. If we go down to the foot, the ankle is referred to as the talus. The foot itself is, the whole entire lower limb is kind of interesting, because during embryonic development, it rotates 180 degrees. So what we see is the anterior surface of the leg is actually originally the posterior surface. So that's why the knee and the elbow bend opposite directions, is because the lower limb rotates during development, and then the foot is moved at a 90-degree angle relative to the leg. And so we have the main part of the foot that we see anteriorly is called the dorsum of the foot. That is the upper surface of the foot. Again, the toes are referred to as digits, and the phalanges are, and the bones are called the phalanges, just like we have in the hand. And the foot itself, the word pedal or pedis refers to the foot. Now, if we look at the posterior surface of the body, we can see some other terms. Again, we have a cranial, which refers to the head, or it can refer to the skull. Occipital literally means the base of the skull, the back of the skull. Nuchal means the back of the neck. If we go down the left side, we see the scapula, which is the shoulder blade, and here the word, the adjective is used, scapular. We have the spinal column, or the vertebral column, and each bone there is a vertebrae. And then the lower part of the back is called the lumbar region, or the loin. The word loin is kind of an old term, so we don't use that much anymore. We usually use the word lumbar instead. And then the area between the hips is called the sacrum, and this is referred to as the sacral area. The buttocks, the word for the buttocks is gluteal. It refers to specifically that area. And then perineum is the muscular floor of the pelvis. And the adjective for that is perineal. So those are specific terms referring to that area. We'll go down the right side in the brackets for the upper limb, we see the acromion. And the adjective for that is acromial. It actually means the point of the shoulder. The point of the tip of the shoulder is not the head of the humerus, but rather it's the acromion, which is at the distal end of the clavicle, and it's actually part of the scapula. The elbow, the posterior part of the elbow, which is the point of the elbow, is called the olecranon. And I've heard some anatomists call that the olecranion. Either term is acceptable. And olecranion tends to be more of an English pronunciation. Olecranon is more of the American English pronunciation. And it literally means the point of the shoulder, the point of the elbow. If we go down to the hand, we see the word dorsum, which refers to the back of the hand. So even though the dorsum of the foot we can see from the front, the dorsum of the hand we see from the back, again, because the lower limb is rotated 180 degrees during development. The posterior part of the knee is called the popliteal region. That's a specific term that refers to that area. It's the hollow in the back of the knee. And the calf area, the back of the leg, is called the sural region, which is again specific to that area. The sole of the foot is called the plantar region, and the heel is called the calcaneus or calcaneal region. So those are those are some of the main terms that we will see in use. Let me go back to this area. We go over to the left side and we look at the fifth word down. That's cervical. Cervical refers to the neck of anything, any structure. So here we're applying it to the neck of the body, but the neck of a internal organ such as the uterus is referred to as the cervical part of the uterus, or the cervix. So that means neck no matter where you find it, whether it's on the main body or in some other region. And some of these other terms also have the same kind of application, although a word like olecranon is only used to describe the point of the elbow. It's not any kind of a generic term. Now we can look at the body as though we were looking at three cardinal planes. We can divide the body into right and left halves, as you see in the top figure. And that's called the sagittal plane. Sagittal is an interesting word because it actually means the flight of an arrow. So you can see that if you have an enemy soldier running straight toward you and you shoot an arrow and the arrow lands right in the middle of the body, then you're going to split the body into two halves, right and left. And that's referred to as the sagittal plane, which literally means the flight of an arrow. The next one down, so now we're looking at a glass, these planes are shown as glass planes. The next one down, which is at a 90-degree angle to the sagittal plane and divides the body into superior versus inferior, is called the transverse plane or the horizontal plane. You can see an image at on the top, that the kind of image we would see on a sagittal, mid-sagittal plane. So going right down the middle is called mid-sagittal. Anything off to the side of the midline is called parasagittal. Para means beside. Now we don't see that in a transverse section because we can divide the body anywhere we want to, up and down. And this one's actually quite a bit higher. The cross section you see is quite a bit higher than the glass plane. The glass plane's down toward the upper pelvis. The picture we're seeing is actually in the area of the liver and stomach, which is the upper part of the abdomen, not the lower part, which is where that glass slide is. The last plane, the third plane, is perpendicular to both of the other planes and divides the body into front and back halves, anterior versus posterior. So you see the sagittal plane is left and right, the transverse plane is superior, inferior, and the next plane, which is called the coronal plane or the frontal plane, divides the body into anterior versus posterior. And you can see an example here that the best way to look at the structure of the hip, for example, is to take a frontal or coronal plane. Now, coronal is an interesting word being used here because it's the same root as coronation, which means to put a crown on somebody's head. Coronal actually means circular, and it's not clear why that term was chosen for this particular plane, because normally we think of coronal as would be in more of a transverse plane going around the head. But coronal in an anatomical term separates anterior from posterior. It's a word that is kind of oddly applied, in my opinion, in this particular case. Now, the last thing I want to talk about in this lecture are movements. And movements can become very complicated because, particularly when we look at the lower limb, and people have misused these terms considerably, in some cases at least. When we start talking about the muscles in a couple of lectures, I'm going to start talking about what the muscles do, that is their action. And so it's important for us to understand these movements to understand the action of the muscles on the body. So here we see a person standing, looking at her left side, and she is moving her left upper limb at the elbow. So we see flexion being bending the elbow, extension being straightening the elbow. Now, the term flexion actually means to bend, and extend literally means to straighten out. So when we look at the elbow, it becomes very obvious to us where flexion is and where extension is. That's one of the few places in the body where it is obvious. We end up in other places where the motion becomes much more complicated for us to describe, and people end up getting things screwed up a lot. So let's look at, while we're here, let me describe another term which is not shown in this figure. But if this lady were to fall and hurt her wrist or elbow and go beyond the normal range of extension, so most people can extend their wrist a small distance beyond normal extension. But if you damage the wrist, that's referred to as hyperextension. Hyper is an injury term. If you go beyond the neutral plane of extension, and you can try this on yourself, you can see how far you can extend your wrist more posteriorly. Some people refer to that as hyperextension. It's not hyperextension, because hyperextension is an abnormal movement. This is just a normal part of extension. And it'll become more clear when we talk about something like the shoulder, which we'll talk about now. If you look at the shoulder, which is shown over here on the left side, it's not clear where you're bending it, that is flexion, and where you're straightening it back out. So flexion and extension kind of break down in their absolute terms when we get into structures like the shoulder and the neck and the trunk shown in these three pictures. So, but the definition of extension is, and all three of these pictures, we have divided this and shown the coronal plane here. And remember that the coronal plane is that plane dividing the body into anterior and posterior parts. Anything moving either toward or in front of the anterior of the coronal plane, that is anterior to the coronal plane, is called flexion. Anything moving posterior to the coronal plane is called extension. Now, in the previous picture, we showed the elbow being bent for flexion and returning to the neutral position for extension. So if we look at the shoulder over here on the left-hand side, if we take the upper limb and we move it back to the neutral position, that's called extension. That's fine. But we can continue with the extension back quite a ways into the posterior to the coronal plane. That's also extension. Now, unfortunately, there are a lot of people mostly who teach at the undergraduate level are teaching anatomy and physiology. Some of anatomy and physiology books refer to this as hyperextension. That is not hyperextension. Hyperextension is abnormal. So you can take this shoulder where it is now, and one could fall, say, on the ski slope or running on the track, and you could push your shoulder back beyond its normal limit posteriorly, and that injures the shoulder. That is hyperextension. In all of the medical school level textbooks, all the kinesiology books that I've looked at, physiology books, hyperextension, if you look at Stedman's dictionary, hyperextension is an abnormal movement. So flexion, if let's go back to here. So if the upper limb is in this position, anything moving anteriorly is flexion. So I can go from this position to the neutral position, that's flexion. Going from the neutral position anteriorly, that's also flexion. Now we can see the same thing happening when we look at the head and neck. So moving anterior to the coronal plane or anterior in relation to the coronal plane is called flexion. Moving posteriorly is an extension. And I was really galled when I was down at Brigham Young University substituting for a year in teaching the anatomy labs. the textbook that they were using down there basically literally took our illustrations here. We had these photographs specifically made for our anatomy and physiology textbook, but they're owned, the plates, the original photographs here are owned by the publishing company, which is McGraw-Hill. And they had an anatomy book that was published also by McGraw-Hill. And so therefore they could use these same photographs. But they had taken this center photograph and incorrectly labeled this hyperextension. Even after in our textbook, we go to great lengths to explain what the difference is between normal extension and hyperextension. So in this person's case, this is normal extension. If you were in a car and somebody hit you from the back and caused whiplash in your neck, that's hyperextension. That is an injury creating motion. Normal extension does not create injury. Normal extension is not hyperextension. So that's an important thing to understand. The same is true if we look at the trunk. If we're moving anterior relative to the coronal plane, that's extension. So extension you can see is here. And moving anterior to the coronal plane is flexion, which you see here. And if we look at the body from an extended position, moving back toward the coronal plane would also be flexion. Whereas here, anything moving in the opposite direction relative to the coronal plane is called extension. So you would extend back to the neutral position and you can extend beyond it. That's not hyperextension, that's normal extension. Now, when we get to flexion and extension of the lower limb, we end up with a dilemma because it doesn't relate to the anterior and posterior region relative to the coronal plane. And that's again because that lower limb rotates 180 degrees during development. So we go back to our original definition that flexion means to bend the knee and extension means to straighten the knee out. Now we end up with a real problem. It's not a problem in my opinion, but for other people, it's a problem because we don't know when we're extending and flexing the ankle. It's actually quite simple because if you move toward the anterior surface, which is this, you are flexing. And when you are moving toward the dorsal surface, you're extending. But mostly physiologists don't like that. And because I wrote a textbook with two physiologists, essentially, I got outvoted. I would like to call this movement here extension and this movement flexion, even though when a person is fully extended, if you will, say in a dive, fully extended, everything is extended except the ankle and it's flexed. But people don't like that. So this is referred to as plantar flexion and dorsiflexion, which are terms that I personally don't like, but that's what we're stuck with. The problem is when you get to the muscles that plantar flex are actually flexors, and the muscles that dorsiflex are actually extensors, and they're actually called that. Extensor digitorum, for example, is the muscle that extends the toes, but that's called dorsiflexion. Now we have some other terms here. Abduction means to take away from the midline. So you can see that when you separate your fingers, that's called abduction. Abduction literally means to take away. Adduction is bringing the fingers together, adding them together. Add means to bring together. And so those are pretty straightforward terms. We can see adduction of the upper limb when we come toward the body, and going away from the body is called abduction. I had a reviewer that I had a long discussion with about this, and the reviewer argued that once you pass 90 degrees, you're abducting until you get to 90 degrees. And then once you go past that, you're actually adducting again. You're actually coming toward the midline, which is a reasonable argument. But the problem is that we end up with sort of a clash of terminology when we go to muscle function. we can look at rotation of a structure such as the arm. The arm, remember, being the area between the shoulder and the elbow. In order to really demonstrate rotation in the arm, we need to have the elbow flexed, because otherwise, if a person keeps their elbow extended, most of what we think of as rotation ends up being supination and pronation of the forearm. So if you really want to look at rotation in the arm through the humerus, we really need to have the elbow flex, and that's why these photographs are shown that way. So medial rotation is bringing the hand across the body, whereas lateral rotation is moving the hand out away from the body. And you can see that the arm is pivoting and rotating medially on the left and laterally on the right. One can see in the hand that we can see supination versus pronation. We're doing this movement in a flexed, with the elbow flexed. So you can see that supine, the word supine literally means belly up. Prone actually means belly down. And so we're talking about the palm of the hand as if it were the belly. And so supination is with the hand superior, or if the upper limb is in the neutral anatomical position, supination has the palm of the hand anteriorly. Pronation rotates the palm of the hand posteriorly. There's a weird term here that refers to the shoulder sort of making a cone-like motion called circumduction, term that is used, but we don't really have any application for it once we get into the muscle functions. Circumduction is actually kind of a combination movement of adding a whole bunch of both flexion and extension and abduction and adduction movements sort of combined. There are a number of structures in the body which we can elevate and depress, such as the scapula. And you can see that on the left is pretty much the neutral position with the scapula depressed. There are muscles that actually depress the scapula, however, but gravity is a big player here. But you can see that we can shrug the shoulders, elevating the shoulders, that's called elevation. That means to lift, like an elevator. We have terms, we can also protract and retract the scapula, but we're showing this in the jaw. We can protract the mandible and retract the mandible relative to the rest of the skull. We can actually, in the process of chewing, we have lateral excursion. And this is showing lateral excursion to the right and lateral excursion to the left. And then when we alternate those and we then contract the muscles on the other side, we move the jaw back to the midline. So excursion is simply taking away from the midline. It's almost, it's essentially the same as abduction, but we use the term excursion when we look at something like the mandible. Here's one that's a kind of an oddball because we have the term opposition, which means we can oppose, bring the little finger and thumb together. That's actually the movement. There is technically no counter movement of that, but people have sort of invented this counter movement called reposition, which that's fine. When we look at the foot, we have again a problem because of the fact that the leg is rotated 180 degrees, and then the foot is flexed 90 degrees relative to that, or extended actually. And so when we look at pronation and supination of the foot, it's a little bit more complicated. So supination is turning the foot so the palm is facing inward, and that's also called inversion, which I prefer because it makes more sense. Eversion of the foot means that you're moving the plantar surface laterally, which is also referred to as pronation. That is the end of lecture 2. Thank you for joining me for this. And I will stop the sharing and I will end this session. Thank you very much.